For this exercise, your patient should stand up against a stationary object such as a door or wall. Your patient should then push into shoulder extension to create an isometric contraction of the posterior deltoid, triceps, lats, and teres major. They should be standing up tall with a neutral spine to decrease any compensatory movements. For this exercise, your patient should create tension with the band as their arm goes back into shoulder extension. They should be standing up tall with a neutral spine to decrease any compensatory movements. Have your patient hold the resistance band with a neutral grip so that their arm can be straight at all times. This exercise, your patient should have their elbow bent at 90 degrees. The lateral side of their arm should be up against a fixed object to create an isometric contraction of the infraspinatus and teres minor. They should push their elbow into external rotation while having their spine neutral and straight to decrease any compensatory movements. In this exercise, your patient should be side-lying with their injured shoulder facing the ceiling. Elbows should be bent at 90 degrees and in contact with their body at all times. Next, your patient will keep their humerus stationary as they pivot their elbow on their body. Their head and neck should be in line with their spine for best results.
For this exercise, the patient is going to be standing, facing the wall, making sure their back is straight. Their elbow will be bent to 90 degrees, their fist is going to be touching the wall, and then they're going to drive their fist into the wall. This should be done for 10 seconds, 10 times. This exercise is considered isometric because we have the wall blocking the movement. For this exercise, the patient is going to be on their knees with their back straight. They're going to have their elbow bent to 90 degrees, close to their torso. They're then going to pull the resistance band towards their belly button, internally rotating their shoulder. This exercise should be done for 3 sets, 10 reps. For this exercise, this should be done with 5 pounds or less. The patient will be lying down on the table with their non-moving arm supporting their head to make sure their spine is in line. The patient will then have their elbow bent to 90 degrees. Starting in a neutral position, the patient will then internally rotate their arm to their belly button. This exercise should be done for 3 sets, 10 to 12 reps each. For this exercise, the patient is going to be standing upright with their back straight. Their shoulder is going to be abducted to 90 degrees, externally rotated, and their elbow bent to 90 degrees. They're going to keep their shoulder abducted and then internally rotate. They're going to keep their elbow bent to 90 degrees while doing this exercise. They're going to then return to the externally rotated position. This exercise should be done for 3 sets, 10 to 12 reps each. This exercise should be done with 5 pounds or less.